Hello everyone. So today we'll be discussing on Arnold-Chiari malformation. So what is Arnold-Chiari malformation? So the Arnold-Chiari malformations are a group of abnormalities which involve the rhombencephalon and which is also called as hindbrain and also involves the contents of the CV junction. So you can see this is the foramen magnum, this is the bastion, and this is the opistheon, and we are seeing the cerebellum, the lower part of it, that is the tonsil. It is herniating across the foramen magnum, and along with it, it is compressing the brainstem, that specifically medulla, and also the medulla is some part of medulla is also getting herniated along with the tonsils of the cerebellum. So we have six types of Chiari malformation. The first one we'll be discussing is the Chiari 1 malformation. In the Chiari 1 malformation, we have 5 millimeter or more caudal displacement of cerebellar tonsils inferior to the foramen magnum. So this is the foramen magnum. So this is the tonsils, and it is getting displaced by 5 millimeter or more across the foramen magnum. So this is called as Chiari 1 malformation. What happens is that by this displacement, it compresses the brainstem, and it also obstructs the normal pathway of the CSF drainage. So it restricts normal CSF flow across the cranio-cervical junction. It is commonly associated with cervical syringomyelia. About 50 to 75% of the cases are associated with cervical syringomyelia, and on occasions also it is associated with hydrocephalus. Around 10% of the cases are associated with hydrocephalus. So next we'll be discussing Chiari 2 malformation. So in Chiari 2 malformation, you have greater amount of tissue that extends into the spinal canal compared to the Chiari 1 malformation. So you can see that this inferior part of cerebellum is, and quite a large chunk is getting displaced below, and you have brainstem also getting displaced below. So we have a very large amount of tissue which is coming down from the foramen magnum. And then you also see other changes like hydrocephalus, which is much more common than Chiari 1 malformation. You have tactile beaking. So this you can see this is tactile beaking. And so what are the classical features of Chiari 2 malformations? We have displacements of medulla, fourth ventricle, and cerebellum. And almost all neonatal patients, we have associated myelomeningocele. Down, somewhere down the spine, you will see a myelomeningocele. And the term Arnold-Chiari malformation is specifically reserved for type 2 malformation. So the right term to be used for this group of disorder is Chiari malformations overall, and only type 2 malformations are called as Arnold-Chiari malformations. Next, we have Chiari 3 malformations. What are Chiari 3 malformations? So Chiari 3 malformations are also extremely rare, and they are usually seen in neonates because they are very severe, and they present in neonates immediately after birth, and they are characterized by a encephalocele which usually lies in occipital region or high cervical region. So you can see this is a encephalocele which is a defect in the right now in this particular MRI. There is a defect in the occipital region from where we are seeing the contents of posterior fossa which are getting herniated. And in this, classically, we see herniation of cerebellum, we see herniation of brainstem, occipital lobe, and the fourth ventricle. And so, continuing with the Chiari 4 malformations, Chiari 4 malformations, we see that there is reduced size of the posterior fossa, and there is a low setting tentorium. So this is the tent. So you have a low setting tent, and the posterior fossa is very small, and all the posterior fossa contents are very much crowded. You can see they are all very much crowded, and there is lot of compression over the brainstem. So this is characterized by marked cerebellar hypoplasia or aplasia and tentorial hypoplasia. So, but there is no hindbrain herniation. So it is not very similar to the rest of the three Chiari malformations where we have seen that there is some sort of herniation. In this particular malformation, there is no herniation and there is cerebellar hypoplasia or aplasia along with a very small posterior fossa and a tent which is low fixed. So there is a lot of crowding of the contents in the posterior fossa. And usually there is no hydrocephalus seen in Chiari type 4 malformation. Now coming on to other type of Chiari malformation. So what we saw earlier were four classical types of Chiari malformation. So coming on to other type of Chiari malformation. What is Chiari type 0 malformation? So syringohydromyelia, that means syrinx formation inside the spinal cord without any hindbrain herniation that responds to the posterior fossa decompression is called as Chiari type 0 malformation. That means there is some physiological defect in the CSF flow across the foramen magnum, but there is no MRI finding which suggests that there is any hindbrain herniation or tonsillar herniation. Okay, and but we can prove this that there is a abnormality in CSF flow. So while doing CSF flow studies in MRI, you will be able to prove that there is some problem with the CSF flow across the foramen magnum. And if I go ahead and operate this kind of patient by doing posterior fossa decompression, then these kind of syringes will get relieved after the surgery. Now coming on to Chiari type 1.5. So it is severe form of Chiari 1 malformation. In what happens Chiari 1.5 malformation is that entire cervicomedullary junction and the orbix is situated below the foramen magnum. So most part of the cervicomedullary junction gets herniated below the foramen magnum.